I'm Ethan Brown. I'm a movement disorders neurologist from UCSF. Thank you very much for having me down. Thanks to Sarah and the foundation for having me. I'm going to talk today about the brain-gut connection in Parkinson's. I'll try to touch on nutrition, symptoms, and medication management. It's a pretty big topic, so we'll have some time, hopefully after this, for questions, but I'll also be around throughout the day, so you can find us for any specific questions you have. Let's see. These are just brief disclosures, just to mention that I am doing some research, as Sarah mentioned, in the gut microbiome. I'll talk about that trial a little bit and the aspects of the trial that we're looking at, so we can talk about that further today. The things that I want to touch on, so first of all, why are we interested in the GI tract at all in Parkinson's disease? Why is there so much focus on it in research? Also, what we can do about it. So specifically, probably the best way that we can take advantage of all of this research is through the diet. So I'll talk a little bit about the diet and how that relates to Parkinson's disease also. And then some interactions between medications and the diet, because those are very clinically relevant often. And finally, we'll talk a little bit about the microbiome. So why look at the gut in Parkinson's in the first place? Why look at the gastrointestinal tract? Most people, this conversation always starts about symptoms. So gastrointestinal symptoms are very common in people with Parkinson's disease. Most of the time, that's constipation. And if you look at people with Parkinson's disease, often constipation is a very, very early symptom. A lot of times happening long before the motor diagnosis is even made. So there have been studies that can find that constipation is more common in people with Parkinson's even decades before they get diagnosed. And then some other non-motor symptoms are also common, but constipation is often very first and can be very severe. Constipation is common in a lot of people, but we really think that the constipation in Parkinson's disease is part of the condition. And we think that because there have been studies that actually take biopsies of the GI tract and find the protein, alpha-synuclein, that we think is one of the causes of Parkinson's disease. That's also found in the gastrointestinal tract. So we really think that it is the condition involving the gut. And actually there are some people that think that maybe even the disease starts in the gut and spreads up into the brain, and maybe there's something about the gut that's actually helping to start the disease. More and more people are thinking lately, well, maybe if it's not that, maybe it's still the environment in the gut, and that inflammation in the gut can be worsening some of the symptoms of Parkinson's or worsening the progression. So there's a lot of interest in kind of helping reduce that inflammation that's coming from the gut. And when we talk about inflammation of the gut, a lot of people are realizing more and more that that may be exacerbated by our diets. So as it turns out, a lot of the foods that we metabolize may be causing things like free radical production or oxidative stress or DNA damage, and a lot of that may be worsening inflammation. And then there are other foods that are more anti-inflammatory, foods that tamper down inflammation. So more and more diet recommendations are focusing on inflammation and talking more about inflammation, and this may be particularly applicable to people with Parkinson's. So I'm going to talk a little bit about the diet because I really think that's the best way that we could take advantage of this brain-gut connection that we talk about in Parkinson's disease, that we could take advantage of it right now. There's a lot of interesting science and a lot of interesting trials going into it, but I get a lot of questions from patients, what does this mean for me now? What does this mean for Parkinson's disease now? And I think one of the main things that it's teaching us is perhaps how important the diet can be in people with Parkinson's. Just as a disclaimer, I'm not a dietitian. A lot of what I learn is from dietitians and from clinical trials. But in a lot of these cases, it may be good to speak to a dietitian, and we'll talk about that a little bit too. And also, just as a disclaimer, I never thought that I'd be talking about the diet. I'm one to love some foods that are not very good for you. So we can all try to work on this together and try to go through some strategies that may be good for people together, because it's a hard thing to look at. In general, just to say, there are no specific diets for Parkinson's disease. So the same kind of healthy recommendations that you're used to hearing about are applicable for people with Parkinson's. We'll talk about, some of them are being studied in people with Parkinson's in particular, but really there are no specific diets. There are a lot of dietary things to keep in mind for specific dietary things that may apply to people with Parkinson's, specific foods, but in general, there are no specific dietary regimens. I will talk about some of the dietary regimens that you see a lot in the news and in different articles, because I think these are useful for studies, and I think they're useful for guidelines. I don't always think they're useful to adopt wholeheartedly, one of these diets necessarily. Sometimes that's very difficult to sustain, but I think that they are useful to talk through and to understand what about them makes the foods healthy and what about them could help people with Parkinson's. So these are some of the ones that are kind of the most popular talked about, so I'll go through some of these. So the Mediterranean diet is probably one of the best studied, and really what it encourages people to do is to increase things like non-refined whole grains. So those are grains that still have bran and fiber as part of them. Things like whole wheat bread, brown rice, but other grains too, like some ancient grains and quinoa, etc. Really increase the amount of fish that you're taking in, increasing vegetables, fruits, beans, nuts, and getting most of your fat from olive oils, getting a lot. And really limiting red meat. This slide's a little bit, so moderate use of full-fat dairy and poultry, but really trying to limit red meat and reduce red meat intake. We really think that these are the tenets of a healthy diet these days. There have been some studies, so this diet was designed for cardiovascular benefit, but people have looked more and more in neurologic conditions and found that adherence to this diet may lead to less cognitive problems as people get older. It's also perhaps associated with less of a risk of Parkinson's and a higher age of onset. Now that doesn't tell us as much about what happens if people already have Parkinson's, but it may mean that it can lead to, kind of slower onset of symptoms. However, I think its Mediterranean diet can be a good diet or perhaps an appropriate diet for someone that's looking for dietary recommendations. There's also the MIND diet, which was similar to the Mediterranean diet. It just took a couple things and added or specified a few areas that people think are at least theoretically better for the brain. So this is green leafy vegetables and berries, and limiting things like pastries, sweets, fast food or fried food, and butter. Trying to limit those more and replace them with things like olive oil. These are kind of theoretically better for the brain. There hasn't really been clinical data that shows that the MIND diet, there's been a little bit, so it's in some studies associated with a lower risk of dementia and better cognition, but the effects in Parkinson's are not well known. And again, as I said, some of these things have more theoretical benefit, more basic science benefit for the brain, things like berries and green leafy vegetables. And again, similar to the Mediterranean diet, these are certainly good diets to consider and dietary guidelines to consider if you're trying to change diet. There are other ones that I'll just try to mention briefly. The ketogenic diet and intermittent fasting are diets that are popular, but not diets that I would necessarily recommend in Parkinson's. Ketogenic involves changing the type of food that you're eating so that you're taking in, it's like an Atkins diet on steroids, you're taking in much lower carbohydrates and a lot more fat. And then intermittent fasting is intermittently restricting calories. You may read about these diets, but these are diets mostly that are looking at for benefit for weight loss. There's some theories that they may help in Parkinson's, and one small study looking at the ketogenic diet in Parkinson's. But they're very complex diets, and they do have a risk of malnutrition because it involves limiting food. So these are not diets I would recommend unless you have other reasons for doing it or unless you're under the guidance of a dietitian. Things to keep an eye out for in the future, but nothing that I would particularly recommend. And then I get a lot of questions about supplements. So some supplements have been studied in Parkinson's disease, although there hasn't been benefit. So coenzyme Q10, vitamin E, creatinine, these have been studied in good studies, but unfortunately there was not benefit to it. Although there still is a lot of indication that there's benefit in large clinicals, in observational studies for this, and in basic science. So it may be a good idea to try to get some of these vitamins just in whole foods. And that's usually what we recommend if people are interested in taking vitamin supplements. It's really just to make sure that whatever you're interested in taking, whatever you think that could be beneficial, trying to get those in foods. So a lot of these vitamins are present in things like fish or leafy greens, as I mentioned. So it may be better to get those as part of actual food as opposed to taking extra supplements in particular for it. Some are still being studied, so curcumin, which is in turmeric, and N-acetylcysteine are still being studied, but the jury's out. So right now we would not recommend any particular supplements or vitamins for Parkinson's. Nothing has really been shown to be helpful. And then just in general with diet changes, so again, these regimens I think are useful for guidelines and to kind of understand what you could do to try to make a healthier diet. I should say in general, changing the diet should be something that we think about. So we think, or diet should be something that we think about. I think I'm used to talking to people about exercise and starting exercise a lot when people come in for Parkinson's, and I'm not as used to talking to people about diet. And I think more and more with this brain-gut connection, the research that it may be another useful way that we can kind of, that people can take advantage and adjust their life and make themselves feel better in multiple different ways. So it is something that I've started to talk a little bit more with my patients about. And if you're already on a healthy diet, fantastic. I think continue what you're doing. If you're not, it can be very, very hard to change, and there are a number of different reasons why it's hard to change. But I think not necessarily going full bore, changing your full diet and changing everyone's habits. I think that's very hard to sustain. I think there's like this concept of micro habits these days where you just make one small change, like you eat red meat a little bit less every month, or you add fish a little bit more, and you just make one small change and you kind of can incorporate that and make that a habit and then build on that. And that is usually is a lot more sustainable way to change something that's as inherent as it is diet. Very similar with exercise, starting small and trying to make it a habit and build on that. So in the time remaining, I wanted to touch on a few different issues that are related to this. Medications in the diet, constipation, and the microbiome. So medications in the diet comes up a lot. This is a very common issue. A lot of people have heard about something called the protein effect. It's a very common concern, I should say. So this is the tendency for levodopa to compete with various different types of proteins that we eat in terms of it getting absorbed into the GI tract and then to have effect. So proteins compete for the same type of transporter that levodopa does, that's absorbed into the gut. And maybe also from the bloodstream into the brain. So what this may lead to in some people is what we call dose failures, and those may come up in a few different ways. So sometimes when people eat protein, levodopa takes longer to have an effect. Sometimes it's effective, but it's not as effective for long. Sometimes there's a reduced level of benefit, so it's not nearly as effective as it normally is. And then sometimes some levodopa that may have previously been effective wears off early if people take protein. I will say that in general, I would think it's not as common as a lot of people are concerned about it. In my experience and in others' experience. There was one series actually that looked at all patients and only 6% of people reported fluctuations that were clearly related to protein. That might be a little bit of an underestimate. In that series, people didn't report this until an average of 8 years on levodopa, so it's certainly not an early complication. That being said, it certainly happens in some people, but just to be aware that fluctuations happen for a lot of reasons. So motor fluctuations is a very frustrating issue, and it's a frustrating complication of levodopa, the tendency that after a certain number of years on levodopa, people will, it tends to work for less and less time. And there have been a lot of efforts to try to get around that, either through adjunctive therapies or other formulations of levodopa or more advanced therapies like DBS. So there are a lot of different options that people can consider because a lot of times these fluctuations are independent of what we eat. But in certain cases, it can be related to protein. And I have many patients who come in and say very clearly, this is related to protein in my diet, and this is related to different types of foods in my diet. So what can be done in those cases? First of all, in general for people, I do recommend trying to start levodopa, and these are very general recommendations, so it certainly does not apply to everyone's case. But in general, I recommend people trying to start with levodopa a little bit before a meal. Sometimes people are either too nauseated to do this, or it's just hard when you're starting a new medication like that's multiple times a day, it can be hard to remember. So sometimes taking them with meals is simply the easiest way to take it regularly, and honestly, that's okay. I think that's fine in most of my patients. And then when people develop fluctuations, both my patient and I, we try to get a sense of if it is related to meals at all, through trial and error, through eating different things, maybe through keeping a food diary, a motor diary, or symptom diary. If it does seem to be related to food, or sometimes it can be just related to food itself or volume of food. Sometimes it's more clearly related to proteins, then just simply, the easiest thing to do sometimes is to try to take the medications earlier. So we try to recommend at least 60 minutes before a meal or 90 minutes after a meal. However, sometimes even that's not enough, or people are taking medications so frequently that there is no 60 minutes before a meal or 90 minutes after a meal if you're taking it multiple times a day. And then if it's still clearly very related to protein, it can be an issue. Sometimes sometimes increasing the dose despite is something that we have to do. Or there are different types of diets known as protein restriction or protein redistribution diets, where people move the amount of protein that they eat more to later in the day. So you eat, more either carb or vegetables or foods without as much protein earlier in the day, and you save your meats and your protein heavy meals for later on in the day. The thing to be cautious about for these is once you start restricting protein and shifting things around a lot is you do risk a little bit of malnutrition, and we worry about weight loss in Parkinson's and that leading to more frailty and more complications. So if you're considering something like that, it is not a bad idea to at least involve your doctor and probably a dietitian just to make sure you're still getting enough calories and getting enough protein at the end of the day. But the idea of this diet is that you don't wear off as much during the day and only maybe at night when it's not as consequential. So that could be something to consider if really nothing else is working. The other big thing that I think is a very important issue to control is constipation. And the control of constipation really starts with the diet. So constipation is very common in Parkinson's disease. It can range from people not even recognizing that it's an issue to being severe enough to cause hospitalization. In addition to symptoms, we also think that constipation could potentially, slowing the transit time of the gut could lead to abnormal medication absorption, so it could contribute to some of the issues I was speaking about before with motor fluctuations. And there's also some thought that it could change the bacteria in the gut, which I'll talk about a little bit later, and maybe, exacerbate the permeability of the gut and inflammation and cause some other problems. But certainly it leads to discomfort is probably the biggest issue in most people. And treating constipation, as I said, really starts with the diet. So the best thing is high fiber, eating a lot of vegetables, whole grains, dried fruit, prunes, like up to 6 prunes a day can be very useful. But with fiber needs to come hydration. So fiber is really good at bulking things, which can help, but without hydration, that can sometimes worsen constipation. And I know hydration can be complicated for other non-motor issues. Nothing is simple in Parkinson's disease, but really trying to emphasize that if you can. Metamucil is a little controversial, just to mention that some people find that it is helpful, but some people actually find that it's not helpful in Parkinson's and maybe too bulking and actually exacerbate constipation. So that's kind of a plus minus. And then exercise can actually help with constipation. So keeping your body moving can keep the rest of your body moving. And I would definitely consider that as well. So, and then not to mention all of the other, either over-the-counter or prescription medications that you can speak about with your doctor for constipation. But really treatment of that has to start with diet. All right, I want to touch a little bit too on the microbiome. This is something that I study, and it's something that may be becoming more and more of clinical importance. So the microbiome turns out that you have as many cells in or on your body that are not your own, that are not part of your own body. So these are the bacteria that are living on our skin and throughout our GI tract and elsewhere, up to 1,000 different types of species per person. And we used to think that these bugs were just along for the ride, but more and more we're realizing that they may be very important for physiology and maybe for disease. So these bugs are important for developing our GI tract, they're important for producing motility, they're important for developing our immune system, and we think that they're important for things like metabolizing medications, creating vitamins, and metabolizing food, allowing us to digest a lot of different types of food. And we think that they may go haywire in some types of conditions, certainly in things like obesity and inflammatory bowel disease, but there's more and more evidence that they're being affected in things like in Parkinson's disease or other neurologic issues, and that maybe they're, a big player in this gut-brain connection. Recently, in the last decade or so, there have been a lot of studies that find that the bacteria in people with Parkinson's are different than people without Parkinson's, and pretty strikingly different. Now, in anyone with a chronic condition, probably the bacteria is going to be different. So it's a little hard to interpret this. People with chronic conditions act differently, move differently, exercise differently, eat differently, spend their time in different places. So there are going to be a lot of differences anyway. And people are still trying to suss out whether or not these differences are meaningful. But there is some science backing it up, and there is a lot of interest in whether or not these differences are explaining some of the symptoms of Parkinson's or explaining some of the progression in Parkinson's, and whether or not we can target them, maybe by replacing them or changing them somehow in order to help people with Parkinson's. One particular one that's here is a bug called Prevotella, which is more consistently found to be decreased in Parkinson's disease, and this produces something called a short-chain fatty acid, which reduces inflammation. So maybe without this Prevotella, people are more likely to have more inflammation. Actually, a study came out this week that showed that adherence to the Mediterranean diet helps boost this bug, and bugs like this that can help tamper inflammation. So again, maybe diet is the best way that we have right now to affect even these changes in the microbiome. Other things, this is a little sciencey, but there are bacteria in the gut that metabolize levodopa, and these are not inhibited by the medications that we usually give to inhibit metabolism of levodopa. So we know that these bugs are there in people with Parkinson's in the GI tract. We know that they metabolize levodopa and prevent it from being absorbed up into the brain. The question is if these bugs are having a clinical effect. So are they metabolizing levodopa such that it's, causing motor fluctuations and preventing levodopa from being able to be used effectively? We do think that these bugs grow in people over time. So maybe at the beginning it's not so much, then people take levodopa over years and these bugs grow and grow. And start to metabolize them more. So this is the basis of one of our trials at UCSF, trying to look at this difference. We're treating with an antibiotic that only stays in the gastrointestinal tract versus placebo to try to see if we can alter this level of bug and try to improve the symptoms of, or try to improve the absorption of levodopa through that, whether or not it makes a clinical difference. We're also looking at other things, including the relationship between inflammation and symptoms in Parkinson's and the microbiome in general in Parkinson's, to see if the microbiome could be a target that we could use to try to help some of the symptoms or the progression of PD. So it's interesting times, but we're still trying to learn how to use this in a very practical way. By the way, if anyone is interested in this trial, definitely let me know afterwards. It is a far trip to UCSF, and this does involve coming to UCSF, but we'd be happy to have you. The other big question that I get a lot about is probiotics. So people with, whenever the microbiome is mentioned, we always talk about whether or not it's useful to replace it. So probiotics are supplements that you can buy usually in this over the counter that have quote unquote good bacteria that could perhaps restore good bacteria to the gut. They usually come in capsule form or in powder packets. And they have been shown to be clinically useful for things like inflammatory bowel disease and other types of diarrheal illnesses like traveler's diarrhea. They've not been shown, well, I should say, so there are some small studies in people with Parkinson's where they do help with constipation. So this study was in people with Parkinson's who had constipation, and they took something called kefir, which is a fermented milk, and that helped a lot with constipation. And I think there was another study that showed something similar. So they can be useful for constipation and maybe should be considered. But it hasn't been shown necessarily to help other things like other types of symptoms or progression. So wouldn't necessarily recommend taking them for any particular, for just in general, but may be useful for things like constipation. So I've touched on a lot of different things. Just to say overall, so this the gut-brain connection, I think, is very interesting in Parkinson's, and there's a lot of research and a lot of science going into this. I think the diet gives us another opportunity to take advantage of this, and it should be something that we think about in Parkinson's, and maybe not huge diet changes, but at least small, meaningful changes in our diet. Diet may, almost certainly affects things like medication absorption and constipation, but maybe it can even affect motor symptoms or non-motor symptoms, and maybe even overall progression. So I think that's yet to be seen, but it's definitely something to be considered. General healthy food recommendations are the most appropriate in Parkinson's disease, so the Mediterranean diet or the MIND diet may provide good specific recommendations. And small changes may make a big difference, especially if you're able to sustain them and really change habits. And then, as I mentioned with the microbiome, a lot of these changes may act through changes in the bacteria that are in our gut. And then personalization. So, it's very hard to give advice in general to people with Parkinson's. Everyone's situation is so different, and this certainly applies when we're talking about the diet also. A lot of people, the diet is a huge entity that's reliant on, cultural habits, family habits, other health conditions. So really taking the advice that you read and knowing that your situation may be a little different and trying to take it a little bit piecemeal, and speaking with a doctor or with a dietitian to try to help you is probably one of the best ways to really personalize it and really make sure that you're making the right changes.